Ask Dr. O. Trustworthy, competent, confident, professional, honest, focused, intelligent, disciplined, real answers to real questions. A healthy mind is a healthy body. AskDrO.com.
Hello, how are you doing today? A lot of you have really began to press me on giving you a good brief lecture on the difference between bipolar disorder and just basically unipolar depression, or what we call garden variety depression. When you look at unipolar or just garden variety depression, these people have issues such as sleep disturbances. They can't sleep, or they're sleeping too much, don't really want to go out, don't really want to interact with a lot of people. Some guilt, hopelessness, low energy, difficulty concentrating. You can eat too much and too little. Sometimes they crave carbohydrates, and sometimes they just feel like, very agitated, or they can just feel just sort of like lifeless. And the most important symptom would be suicidal ideation, and that is something that's cardinal when we begin to talk about unipolar depression. Now, when you talk about bipolar depression, bipolars have both the symptoms of the basic depression I just talked about, but they have the other symptoms which are more disabling. They can be distractible, they talk a lot, they're difficult to interrupt, their thoughts race, they can be grandiose, they can be hypersexual, they can be mean, they can be irritable, and they really can accomplish a lot of tasks because they have lots and lots of energy. So those with bipolar tend to be a little bit more dangerous and a little bit more out of control. Some things you may notice about a bipolar patient is like Gucci Man marking up his face, doing exotic and erotic kinds of things. They can do excessive spending. They can do a lot of like these 1-900 phone calls, or a lot of illicit kind of behaviors that can get them into trouble. They can run all the credit cards up to the 10th degree and not have the money to pay for them. So bipolarity is a bit more disabling than depression, and it can cause some legal issues. Now, what to do if you think a friend, a family member, a husband, a brother, or sister may have bipolar illness? Now, one thing, a lot of people don't really like to be challenged or to talk to anyone about their mental status. So what you can do is you can gingerly start some discussion over the dinner table. Maybe you can ask and say, do you ever feel like you're just racing and racing and racing and just can't bring things into control? Maybe are your thoughts racing? You're having problems putting things in perspective. It's a little bit more than normal. Or do you find yourself up in the middle of the night for no reason at all for 3 and 4 days straight? And you get up the next morning to go to work without any problem. So you can start by gingerly having some discussion about how things are going. Do you feel real fast? Do you feel sped up? Now, you got to be very cautious now. ADD is very much so different than bipolar illness. That's why when it really comes to these diseases, although I'm giving you a little bit of information or a few facts, take them to the nearest mental health professional, preferably a psychiatrist. A psychiatrist is an MD, a medical doctor, who could look at all the differential, what it could be, check your thyroid out, check your liver out, check your heart out. The psychiatric physician can do all of this. I have nothing against psychologists or licensed clinicians, but the diagnostics phase should be with a medical doctor. A psychiatrist is a medical doctor. A psychologist is not a medical doctor. They may be good for therapy, but as far as diagnostics, it is my recommendation that you see a physician. Once again, thank you for tuning in to AskDrO.com, and have a wonderful day. And remember that a healthy mind is essential for a healthy body.
AskDrO.com.